Thank you for joining us today. I am Sarah with the Bismarck Cancer Center, and today we're going to be talking about caring for the caregiver. In 2020, approximately 1.8 million new cancer diagnoses will be made in the United States. Roughly 40,000 of those will be in North Dakota. Cancer is on the rise, but survival rates are also on the rise. We are estimating that by 2026, 20 million survivors will be in the United States. What that means is that the chances are very good that someone you know will have cancer. And they most likely will need some sort of caretaking. For some people, that might be as simple as driving to appointments, cooking, running errands. But for others, it might be more labor-intensive assistance like bathing, hygiene, helping with medication management, or helping manage their care. There's many different kinds of cancers and there's many different kinds of treatment. You may have surgery, chemotherapy, radiation therapy, immunotherapy, hormone therapy, or a combination of any of these therapies depending on your diagnosis. Each treatment has its own side effects and drawbacks, and everyone tolerates the treatment differently. But just as a general idea, some of the side effects that you may see include things like hair loss, particularly with chemotherapy. When a person loses their hair, they also lose the eyebrows and eyelashes, weight loss or weight gain, depending on what kind of treatment they're having. Your appetite can change. Your taste and smell, or your sense of smell and your sense of taste can change as well. Fatigue is a side effect that's common for almost all of these different treatment modalities. Also, you may see people, their skin may be more pale, or their lips and might be more pale. They'll just look different than they used to. A lot of times for surgical treatment, the result is disfigurement, such as amputation or a mastectomy, or somebody with colon cancer might end up with a colostomy. That can greatly affect a person's sense of body image. Nausea and vomiting are common with most treatments, as well as difficulty sleeping. And there's also a side effect called chemobrain that happens from chemotherapy that makes people feel more forgetful, or like they have a harder time concentrating. It's important to know that this is very normal with chemotherapy. And so if you see a loved one going through this, it's an anticipated side effect, but it can be very frustrating for the patient. In addition to physical side effects, there's a lot of emotional ones that happen with the radiation. Everyone reacts to their treatment different. You may go through one of these feelings or all of them, and it can be a slow process to feel these feelings, or it can happen very quickly, making the patient seem as though they're kind of emotional or moody. Some of those feelings include feelings of anger, sadness, fear, guilt, resentment, hope or hopelessness, peace, anxiety, and a lot of things depend on, a lot of these feelings and emotions depend on what else is happening in a person's life. Some people who have a lot going on in their life, maybe they have young children, you're going to see a lot more of the resentment and the guilt and fear, where people who get diagnosed and treatment later in their life are often more at peace, and have a little bit of the hope quality. All of these feelings are normal, and you can expect to see them off and on throughout their diagnosis and beyond. So we talk about sharing information in healthcare. Patient information is private, and I can't share it with anyone I want, because that is the patient's right to share their healthcare information. As a family member or a caregiver, you may feel a little bit differently about that. You may be tempted to share your mom's diagnosis, your brother's diagnosis. So before you start doing that, before you go on Facebook and ask for hope and prayers, maybe just consider some things about sharing. Number one, ask yourself, why do I want to share this information? And how does it affect me? Ask yourself, are you afraid to share the information for any reason? Would the patient be upset with you for sharing the information? And how does the information affect you as a caregiver? Basically, if you don't need to share it, if you're sharing it yourself, it's maybe better to find a counselor or find a close friend who would be willing to listen, as opposed to if you're sharing it to share with other family members and keep everyone connected with the permission of a parent who's going through treatment, then that's a different story. Just before you do any information sharing about someone else's protected healthcare information, just think about why you're doing it. When talking to someone who's going through a cancer diagnosis, there's a couple do's and don'ts that we talk about. First of all, do tell them that you care about them. Don't offer your advice or be judgmental. Don't offer advice unless you're asked for it. Take a cue from the person with cancer. If they're not interested in talking about it, maybe table the conversation for a later date. Don't assume they can't take care of themselves, but do offer to help them if you're able to do that. Respect their decision about how to treat cancer. Even if you don't agree with it, we have a lot of people who say, I do not want to go through chemo. And even though their outcome may be better with chemo, they choose not to because they do not wish to go through the side effects. That's their choice as an adult. So respect that that's how they want to live their life. And don't take things personally. Like we talked about before, people will be emotional. They will be a little more short-tempered or cry more easily. Don't take it personally. Don't be afraid to talk about the cancer, but don't make that the only thing they talk about. So it's okay to acknowledge the cancer, to ask about appointments, to ask about treatments, but this is not the only thing in this person's life. They still have other family. They still have other activities in their life. They still want to be a part of the normal world and not just about cancer. Do include them in their usual projects or social events. If Monday is card day for your friend and she's going through cancer treatment, still invite her over. She may not feel like playing, but she may just enjoy the socialization. Even if she declines, she might appreciate the invitation. Do use good hand hygiene. Do cover your cough. Be careful. These people are immunocompromised. And so how we would normally not be so concerned about our hand hygiene, our health hygiene, be a little more cautious with these patients. And I say this with hesitation because we're in a pandemic where everyone's concerned about hygiene. And so that's a good thing. Keep doing that even when the pandemic has ended. Listen to the patient without feeling like you need to respond to them. People are not always looking for a solution. Sometimes they're just looking to express their feelings. Don't avoid them because you aren't sure what to say or you're uncomfortable. And don't make them feel guilty for missing events. If they can't make it to your child's soccer game, that's okay. They have other stuff going on in their life. Do expect good days and expect bad days. It may be vital to find a new normal and not be overbearing. Everyone's experience is different. Some people will work full time all the way through treatment and never miss a beat. Some people are very tired or emotionally drained and need time to themselves. Respect that this is going to require some flexibility from everyone in the cancer patient's life. How can you respond when someone tells you that they are going through a cancer diagnosis? You can first mention the situation in a way that feels comfortable for you. showing concern, encouragement. You can use humor if this is somebody that you have a rapport with and have a history of using humor. You can avoid telling them that you know how they feel. Even if you've been through a very similar cancer experience, don't tell them, oh, I know how you feel. Everyone's cancer experience is unique. And even if you had the same diagnosis and the same prognosis, you will still have different experiences. Let them know when they look good, but try to avoid commenting when they don't, and be specific, like, oh, wow, your eyes are really pretty with makeup. Um, when you say generalized comments like, well, you look like you're having a good day, or you look really good today, it kind of makes them think like, did I not look good yesterday, or have I been looking poorly? So, compliment them. Um, Avoid the, oh, wow, you look terrible comments. Try not to share stories about yourself, family, or friends who have had cancer, particularly if the outcome was not a positive one. Um, don't show false optimism. Don't tell them things like, oh, this is going to be fine. You'll get through this. You don't know that. So, optimism is okay, as in, we can find a way to make this the best experience it can be, something like that. But don't tell them that everything's going to be fine unless you know that everything is going to be fine. So disagreeing is really common between a caregiver and a patient. So it's important to learn how to communicate with them, and find some hope in the choices that your loved one makes. And this kind of goes back to respecting their decisions. So some topics that people disagree on is how to live. Maybe the patient's having a lot of pain, and they would like to use medicinal marijuana to treat their pain rather than traditional narcotics. And maybe the family member doesn't agree with that. So that's something that you might disagree on, or who to spend time with, what activities and work to pursue. You might disagree on whether or not your spouse should work full-time during treatment or part-time. You'll have different opinions about what things to experience. Do you go on a big trip? Do you spend your time at home with family? And you'll also disagree with who and when to ask for help. So a lot of times patients don't want to ask for help. So they generally have one or two close family members who are kind of their main caregivers, and they also don't want to ask for help because they don't want to burden other people, and it leads to some caregiver burnout, which we'll get into shortly. So it's important when you're making decisions to remember that the patient has the right to make their own decisions as an adult. So when it comes to things like what medications they want to take, that's a patient's choice, not the caregiver's. When it comes to things like who and when to ask for help, the caregiver should probably have a little bit more say in that, simply because the burden of caregiving has been put on that person, and so they should have some say in who they can get help from. The same with delegating tasks that need to be done. So, it takes a lot of compromise if you're disagreeing about things, and sometimes it's helpful to even get a third party, neutral party to help sort through some of that stuff. Good resources include nursing staff, counselors, social workers, that sort of thing. So when we talk about patients and their work, a lot of times work is important to people, and it gives them a sense of importance, boosts their self-worth, makes them feel useful. A lot of people will also need to work through treatment for financial stability, or maybe to maintain their health insurance. And it also provides contact with other people. So allow your loved one to do as much as they can within their limits. Keep them motivated, and make sure that they're still getting self-care so that they can bounce back more quickly, and they're still taking care of themselves and not running their emotional bank dry. Also remember for the caregiver that it can be overwhelming for the caregiver as well. So sometimes taking time off of work is good emotionally, and for the same reasons it's important to go to work for the patient, it's also important to have feelings of self-worth and purpose for the caregiver as well. It's sometimes nice to just get away from the cancer diagnosis and do some normal things. So when we talk about being the caregiver, there are some tips for being a caregiver. Remember that caregiving is very rewarding, but it's also stressful. So caregiving is a team effort. Generally, when people get a cancer diagnosis, they have people coming out of the woodwork saying, "Let me know what I can do to help." And most often, the caregiver or the patient never lets anyone know what they can do to help. So caregiving is a team effort. You cannot do it all by yourself. So be proactive, be organized, plan as much as you can. If somebody's offering to help, have a list in the back of your head kind of ready. So you could say, you know what would be really helpful? My kid has to go to basketball practice on Tuesdays. They go with your kid. Could you pick them up so that I can have an hour of downtime to myself? Have things that you're willing to delegate. Be a problem solver. So be a little bit proactive. I try and identify things that may be barriers to care or problems in the future, and try to proactively prevent them. Also recognize your personal strengths and weaknesses. Maybe you're a caregiver, but bathing someone or doing their personal hygiene tasks are not for you. Maybe that's something that should be hired out rather than trying to do that for yourself. Maybe it's embarrassing to bathe your father or your mother for either the patient or the caregiver. In those instances, that's just recognizing a strength and weakness. Maybe there's someone else who's more comfortable with that task that would be willing to come in once in a while to do it. Also set boundaries and ask for help when you need it. So just because you're a caregiver does not mean that you can or should overextend yourself to the point where you find yourself broken. So setting boundaries is important. Knowing what is vital to happen and what can be let go are good things. Seeking out information and guidance from healthcare providers, from resources in the community is a good idea. Finding some balance in your life, and then being open and honest with your family, saying, I am tired, I need a break, I'm gonna leave for a couple hours. Those things are all important for caregivers. So caregivers are at a very high risk for caregiver stress, and some signs of whether or not you're developing caregiver stress include abusing drugs and alcohol, constantly worrying or feeling overwhelmed, fatigue, getting too much sleep or not enough sleep, weight gain, weight loss, becoming easily irritated. All of these are signs of depression, as well as what we would quote unquote call caregiver stress. Losing interest in activities, feeling sad all of the time. So when you find yourself with caregiver stress, there are a few things that can be done. Accept help. Forgive yourself for not being able to do everything that you would like to do. Set some realistic goals, prioritize the goals, and make a list. Get connected, whether that's with a community, with local support groups, maybe a yoga class or a church group or a counselor. Just stay connected to humans who are some who have been where you've been, or maybe people completely unrelated to a cancer diagnosis. That's kind of something you need to figure out what you need. Personal health goals include getting enough sleep getting adequate nutrition and exercising. These are all things that are good for your body and will make you a more productive caregiver. Also identify personal stress in your life. You know, is the source of your stress coming from finances? Is it coming from concern about the patient? Is it coming from outside sources, other family members? Identify the source of the stress and then make a plan to reduce the stress. Communicate your needs specifically. If you are vague about what you want or need, then it leaves a lot of room for those needs to not be met. So be very specific when you're communicating with people about what needs to get done and how that needs to happen. That also gives people an opportunity to say, that's not a way that I'm willing to help you, or you know, maybe I can best help you in a different way. If they know what you're expecting, then it eliminates a lot of possibility for disappointment if those needs are not met. So how can others help you? In a couple different ways. They can send or prepare meals for the patient or for the caregiver. They can offer to help with childcare. They can run errands for you, offer to do a load of laundry or clean your house, send care packages, or organize a fundraiser. So these are all things when people are saying, what can I do to help? These are all suggestions you can throw out there. Be realistic about what you need and then ask for it. So most people feel like if they are helping you, the patient or the caregiver, that they are also helping with the fight against cancer. So, you know, it's not people just saying that they want to help and not meaning it. It's that they would like to help, but they just don't really know how to do it. So if you can make it clear to them how they can help, then it will be a much easier process. So with that, if you do not take care of yourself, you're not going to be able to provide help to anyone else. So when we talk about taking advantage of resources and we list the community resources, it is also important for you to recognize that the people in your life are also resources. So that concludes our slideshow. If you have any questions or want any more information, again, my name is Sarah, and I can be reached at sberNDT@bismarckcancercenter.com, or you can call the Bismarck Cancer Center at 701-222-6100, and I'd be happy to answer any questions or offer any suggestions that I can. Thank you for your time.